Hemorrhoids. Hemorrhoids are normal anatomical cushions. These are made up of venules, arterioles, smooth muscles, and elastic tissue. Hemorrhoids are basically anatomical support which are present in the anal canal, and they provide protection to the anal and the rectal mucosa against the straining which is caused by the hard stool. The location of hemorrhoids is at 3 o'clock, 7 o'clock, and the 11 o'clock position. Pathophysiology. On constipation due to excessive straining, there is abnormal descent of these anatomical cushions, which leads to injury by the hard fecal matter and resulting into the bleeding per rectum. Now there are few one-liners about bleeding per rectum. The most common cause of the bleeding per rectum is hemorrhoids. Most common cause of the significant lower GI bleed or the bleeding per rectum is colonic diverticula. So see, there is a difference between bleeding per rectum and significant bleeding per rectum. In hemorrhoid there is a small amount of the bleeding, while there is significant amount of bleeding in case of colonic diverticula. Now another one liner. Most common cause of the occult lower GI bleed is angiodysplasia or vascular ectasia. These are few important one liners for the NEET PG. Now move on to clinical presentation. Clinical presentation, there is a painless bleeding. Why painless? Because the hemorrhoids, usually the internal hemorrhoids we are talking about, they lie above the level of the dentate line, and above the dentate line there is a endoderm. So there are no pain sensations, so there is a painless bleeding, and the amount of the bleeding is 3 to 5 ml, maximum up to 10 ml. As we discussed above, there is a small amount of the blood as compared to the colonic diverticula. So move on to diagnosis. Now diagnosis is mainly done by the proctoscopy. We cannot diagnose the hemorrhoid by the digital rectal examination, the DRE, because they cannot be palpated. They can only be visualized during the proctoscopy. Now type of the hemorrhoids. There are two types of the hemorrhoids, basically the internal hemorrhoids and the external hemorrhoids. They are divided on the basis of their location. The location of internal hemorrhoids is above the dentate line. There is a pain insensitive region above the dentate line because it is derived from the endoderm, and internal hemorrhoids are characterized by the painless bleeding. External hemorrhoids, they are located below the dentate line, that is pain sensitive region because it is derived from ectoderm, and they are characterized by painful bleeding, also known as the 5 days painful self-curing lesions. Recurrent thrombosis in external hemorrhoid lead to semi-ripe black color. The treatment of internal hemorrhoids depend upon the degree. We will discuss later on the classification of the internal hemorrhoids, and the treatment of external hemorrhoids is the excision of the external hemorrhoids. The classification of internal hemorrhoids. Internal hemorrhoids are classified mainly based on their location and associated symptom. They are classified into 4 degrees. The first degree hemorrhoids they are having clinical symptom bleeding only, and they lie above the level of the dentate line. They cannot be visualized externally. The second degree hemorrhoids, they are having the symptom of bleeding plus prolapse during the defecation, which is associated with spontaneous resolution. Means during the defecation the hemorrhoids come out of the anal canal, but as soon as the defecation is completed, they spontaneously go back inside the anal canal. There is bleeding associated with it, but the hemorrhoids go back spontaneously. So second degree hemorrhoids. Now third degree hemorrhoids. In this case also there is a bleeding and the prolapse of the hemorrhoids outside the anal canal. But the difference between second and third degree is that in third degree the hemorrhoids don't go back inside spontaneously. We have to reduce it or reposit it manually. So the basic difference between second and third degree hemorrhoids is that in second degree hemorrhoids the prolapse goes back spontaneously, while in third degree hemorrhoids the prolapse we have to reduce it manually. And fourth degree hemorrhoids, there is a permanent prolapse, means the hemorrhoid don't go back spontaneously, or also there is no reposition of the prolapse manually also. You can see this and the hemorrhoid classification. The grade 1, the hemorrhoid lie inside the anal canal. The grade 2, the hemorrhoid lie inside the anal canal, but during defecation it comes out and get reduced spontaneously. In grade 3, the manual reposition is required, and in grade 4 there is no reposition either spontaneously or manually. Now treatment. The treatment of first degree hemorrhoids is basically the dietary modification. We have to modify the diet, increase the water intake, stool softener we have to advise, and we have to advise high fiber diet, which result in the stool softening, and there is a less amount of the straining at the stool. And first degree, second degree, and selected patient of the third degree, we can advise two modalities of treatment, basically the bending and sclerotherapy. In bending, we apply a rubber band like structure over the base of the hemorrhoid, which result in the ischemic necrosis and sloughing out of the necrosis, and in sclerotherapy we inject the sclerosing agent like 5% free phenol in almond oil, sodium tetradecyl sulfate, etc., inside the cavity of the hemorrhoid, which result in the fibrosis and ultimate shrinking of the hemorrhoid, and no symptomatic bleeding is there. So both bending and sclerotherapy are very cheap and effective. In bending, rubber band is applied over the hemorrhoid, and after 48 hours hemorrhoid are sloughed off because of the ischemia, and the lesion heal with the fibrosis. Now rest of the third degree and the fourth degree hemorrhoids, they are treated by hemorrhoidectomy. Hemorrhoidectomy is basically of three types: open type, closed type, and the stapler hemorrhoidectomy. So there are a few name of the scientists associated with these hemorrhoidectomy. You have to remember them for the NEET PG. The Milligan Morgan open hemorrhoidectomy, the Ferguson closed hemorrhoidectomy, Whitefield submucosal hemorrhoidectomy, Longo's stapler hemorrhoidectomy. The most preferred is Longo's stapler hemorrhoidectomy. The stapler hemorrhoidectomy, this is a picture showing the injection of a sclerosing agent in the hemorrhoid, which result in the fibrosis. Now this is a picture showing the band ligation of the internal hemorrhoids. We apply a band at the base of the hemorrhoid, which result in the ischemic necrosis and sloughing off, and later on result in the fibrosis. This is a picture showing the stapler hemorrhoidectomy. This is all about hemorrhoids. Thank you.